This is Dr. Milescu again. I own Serenity Now Yoga, and I'm doing a series on exercises for hip replacements. I'm, again, between 6 and 7 weeks out, total hip replacement on the left side, 1 year out on the right side. Last episode, we discussed the gluteus medius muscle. Now we're going to talk about the adductors. These are the muscles inner thigh. So the one great exercise that is done in Pilates, also in yoga, and of course physical therapists utilize it in rehab as well. So there's a lot of crossover in the health and wellness field. So I'm going to show you how to get into this movement, into this exercise, and how to cause contraction of the adductors. So which are the adductors? They're specific muscles, inner thigh. The first one is pectineus, which actually gets compromised during a hip replacement. It literally has an origin right on the pubic bone. Additionally, there's the adductor muscles, adductor magnus, adductor longus, adductor brevis. And then the longest muscle along the inner thigh, which you can really see defined in specific athletes that really use those muscles very well, like gymnasts. That's called the gracilis, and it's a really defined long strap-like muscle along the inner thigh. So these muscles post-op really get tight and guarded because they have to hold the fort, literally, for a new implant. So during the 6 weeks, nothing's happening, and these muscles are really kind of trying to stabilize your hip joint as you're walking in a walker, and then eventually with a cane, and then 6 weeks later where I'm at now. So we need to rehab it. We need to not only stretch it, but in this case, I'm going to show you how to condition it and get it back into its proper form post-operatively. So the first thing we're going to do is lay on your side. So preferably start with your surgical side. You have a yoga mat, but if you have a blanket, that'll do as well. So what you want to do is you can put your hand like this, or you can hand on the floor like this, whatever feels comfortable. And the surgical side for me is my left side, so that's the adductor muscle that I'm going to use to contract and lift. So I'm going to flex my left foot. I'm going to take this right foot, cross it over. If this is uncomfortable for you, the modification can be right here and lift it this way. So this is a modification, but typically it gets a little bit harder because you saw how I can tilt back. So I'm glad I did that, because now I'm showing you to engage that core. Remember the triangle. Lift the pelvis up and draw it back. Be able to do the thoracic breath in Pilates and expand from the rib cage. Always keep the solar plexus contracted. All right, so I'm going to put my foot over since I'm able to do that. But like I said, as long as you have your core engaged, you can keep your foot here. So I'll demonstrate the easy modification like this. But typically the exercise should be done with crossover. All right, so what you want to do is make sure the alignment is perfectly straight. And again, make sure that your solar plexus is engaged. Your pelvic floor is engaged, drawing in and up. And here we go. Usually we do about 3 sets of 8. All right, inhale to prep, exhale, contract and lift. Inhale to prep, exhale. So in Pilates, you breathe in through the nose, exhale through the mouth. In yoga, is in through the nose, out through the nose. So whichever day you're practicing, whether you want to practice yoga or Pilates, that's what I do. When I'm really truly exercising and conditioning my muscles, I go in through the nose and out through the mouth. Here we go. So, and go slow. Slow is good because you're really moving through, isotonically contracting those muscles slowly and really making them work. Okay? So go slow. Inhale, prep. 4 more. 3 more. 2 more. 1 more. Good. And that is the exercise that we do to condition and strengthen the inner thigh muscles. All right, till next time, I will see you again for the next series on the total hip replacement exercise.